There are so many different types of birth control. When most people talk about them, they talk about the most effective methods. The truth is, when you take every method the way it's prescribed and you use it perfectly, it is over 99% effective. Most times when people are talking about less effective methods, it's based on typical use. And there's some human error involved. So when you take the pill, if you miss a pill here or there, it's going to be less effective. When I talk about how effective a birth control method is, we often associate percentages with that. When I say 97%, I mean for every 100 people that have sex for a year, 3 of them will get pregnant. An important thing to know about birth control is that the second you stop it or you have it removed, you're able to get pregnant. The only exception is Depo, which is the shot, and that one can sometimes stick around longer than 3 months. Birth control is not just to prevent pregnancy. It can be used to help things like acne and period management. By period management, I mean to make your cycle more predictable, lighter, or go away altogether. If you're not happy with your method or you want it removed and you don't want to get pregnant, go ahead and talk to your provider because we have so many other options we could get you started on if you're looking to prevent pregnancy. Some birth control methods contain hormones. The hormones in these methods are progesterone and estrogen. These are hormones that your body naturally produces. The really important thing about hormonal birth control methods is they take 7 days to become effective as birth control. If you're using this as your primary method to prevent pregnancy, you want to make sure you use a backup method for the first 7 days. The way I'm going to talk about birth control today is in order from high maintenance to low maintenance. So basically what I mean by that is the methods that you use more frequently and have to think about more frequently to the ones that you don't have to think about as much. Condoms. They're 98% effective with perfect use and 82% effective with typical use. So this accounts for condoms that have been left in the heat or have expired or were not put on properly, like pinching the air out of the top. There are 2 types of condoms, internal condoms and external condoms. Both require a new condom each time you have sex. You should never reuse these. Condoms are the only birth control method that can also protect from sexually transmitted infections, which is why you should use one every time you have sex. Plan B, also known as the morning after pill. This can be 85% effective if you take it within the first 24 hours after unprotected sex. This is a pill you take after unprotected sex or a condom breaks. It works by putting your ovaries to sleep so that the egg and sperm never meet. If you already ovulated before you took the pill, then it's too late to prevent pregnancy. It is an over-the-counter medication, meaning that anyone can go buy it at any pharmacy or store you can buy medications from. Oral contraceptive pills, the patch, Nuvaring, Depo, and the Nexplanon all prevent pregnancy the same way. Basically what they do is they thin out your uterine lining and also put your ovaries to sleep, and that way you never release an egg, so the sperm and egg never meet. Oral contraceptive pills are 99% effective when you use them perfectly, and 91% effective with typical use. This includes being late taking the pill or missing a pill. Pills require you to take a pill at the same time every day. If you're really good about taking a pill at the same time every day, the pill is as effective as the Nexplanon and IUD. But every time you miss a pill or are late with a pill, you increase your risk for pregnancy. This is what most pill packs look like. They have 4 rows of 7 pills. The last row is normally a different color, and that is when you're going to get your period. You take the pills like reading a book. Start at the top left corner and work your way to the right before going to the next line. Pills are great for some people to help acne, lighten periods, and to help with period cramps. The patch is 99% effective when used perfectly. Like the pill, it's 91% effective with typical use. The patch is basically a sticker that you put on your body once a week. Most people put it on their back or their low stomach or their hips so it will not be visible. You put the patch on and change it out once a week for 3 weeks. The 4th week, you don't put on a patch, and that's when you'll get your period. If you're good about changing your patch every week, it is very effective like the IUD or Nexplanon. But if it falls off or you forget to change it, you're at higher risk for pregnancy. The patch can get wet, but you don't want to scrub at it when you're in the shower. The patch, like the pill, can also help lighten periods and lessen period cramps. The Nuvaring, when used perfectly, is 99% effective. Like the pill and the patch, it's 91% effective with typical use. The Nuvaring is a clear plastic ring that you put in your vagina for 3 weeks at a time. You take it out at the end of the 3rd week and leave it out for a week for your period. Then you put in a new ring at the end of that week. It is important to keep the Nuvaring refrigerated because the hormones are activated by body temperature. Once you put it in the vagina, the increased temperature lets the ring know that it's ready to rock and roll, and the hormones start to release. Most partners are not bothered by the ring while having sex, and it can be left in. But if you or your partner finds it bothersome, it can be taken out for up to 2 hours. Before you put it back in, run it under warm water to reactivate the hormones. If you leave the ring out for longer than 2 hours or in longer for 3 weeks, or forget to put another one in the week after you take it out for your period, you increase your risk of pregnancy. Depo-Provera, also known as Depo or the shot, is 99% effective with perfect use, so that means you get your shots on time. It's 94% effective with typical use. Depo normally makes periods go away, and some people will experience some spotting or bleeding towards the end of the 3 months. Depo is an injection that you can get in your arm or your butt that works as pregnancy prevention for 12 weeks at a time, so that's every 3 months. This means you'll have to go to a doctor's office 4 times a year for the shot. Just as a reminder, Depo, like the other methods, is incredibly effective if you're on time for your shot. If you're late for your injection, you increase your risk for pregnancy. Nexplanon, also known as the rod in your arm, is 99% effective. There's no typical use because there's no human error that can occur because a provider puts it in place. This method is good for 4 years. Nexplanon most typically will cause a change in your period. 1 in 5 people will not get a period. 3 in 5 people will have some sort of period, but the length and how often it occurs is unknown. And 1 in 5 people have constant spotting or bleeding. If that happens to you, don't freak out. Your medical provider should be able to help you manage your bleeding. It is a small rod that is made out of flexible plastic and is about the size of a matchstick. It goes right underneath the skin on the arm below your bicep. This method has to be put in by a medical provider. Next, we're going to talk about the IUDs. IUD stands for intrauterine device. The hormonal IUD is 99% effective. There are several different types of hormonal IUDs. They protect you from pregnancy anywhere from 3 to 6 years depending on the IUD that you get. They normally make periods lighter or go away altogether. The way that they work as birth control is that they thin the uterine lining so the egg doesn't want to implant, and it also thickens the cervical mucus so the sperm and the egg never meet. Since the IUD lives in the uterus, it requires a procedure where a medical provider uses some medical tools to insert the IUD past the cervix into the uterus. This can cause some discomfort, but normally takes about 5 minutes to get it placed. The copper IUD is 99% effective. This IUD is good for 10 years and can also act as emergency contraception up to 5 days after unprotected sex. This IUD prevents pregnancy by causing a lot of irritation in the uterus and causes inflammation that kills sperm before they can reach the egg. Because of the irritation in the uterus, the copper IUD can cause heavier and crampier periods. The copper IUD is put in the same exact way as the hormonal IUD in a medical office. With IUDs, a lot of people express concerns that their partner is going to be able to feel it during sex. If we talk about the anatomy of a person with a vagina, you have the uterus and then the vagina, and they're separate compartments. So just like you can't feel a fetus during sex, your partner should not be able to feel your IUD. If you have any questions, you can always text us at 720-593-9880, or you can give us a call at 720-777-2248.